Hi, my name is Lauren Armstrong, and my topic is hospitalizations and its impact on child development. This is my research all compiled in one place so it's easy to see, but I am going to break it down into easier chunks for this presentation. A lot about child development in this class and why it's important, and I think ultimately my answer now would be that we are trying to raise children to be the best adults they can be. And obviously there's a lot of factors we can control about kind of their diets and the households they live in and how we treat them. But there's things that are unavoidable, like illnesses or trauma that might result in hospitalization. And I was curious to see how that would affect their development. Like this topic. I was really curious to see if hospitalizations affect development, specifically looking at if younger children that are currently learning motor, speech, or behavioral attributes or skills would be impacted developmentally because of the hospitalizations. I'm specifically interested in this because I do work at Primary Children's here in Salt Lake City in the neuroscience trauma unit, and I see a lot of different patients that come in for traumas related to like car accidents or ATV accidents. I see a lot of things that are like seizures, or another big thing we see is like myelomeningocele, which is a birth defect. So there are so many things that already impact development, and I was curious to see if hospitalization, especially frequent hospitalizations or long-term hospitalizations, are going to impact that development. The enduring themes that I felt connected the most to this topic are social cultural context, individual differences, and research can promote children's well-being. Starting with the first theme, social cultural context, this is the idea of the environment the child is living in is going to influence every aspect of their life, whether that be living with married parents or divorced parents, what kind of food they're eating, where they're going to school. All of those things influence a child's life, and that's the same for medically complex children. So I wanted to look at their development of childhood, and this is supported specifically by a study done by Sawyer et al. In 2023, who was looking at patients of a brain tumor study who were pediatric and were having to be hospitalized for their brain tumor treatment. And a lot of these children reported a loss of childhood due to their hospitalization. Another theme I thought connected really well to this topic was individual differences. Obviously, children and even adults all have differences of how they're going to react to a situation or how they feel about something. And so I thought SCAR's four factors of differences being genetics, treatment by others, reaction to similar experiences, and differences in choice of environment was really driven and connected to this topic. And once again, we're looking at the brain tumor patients from Sawyer et al. And they wanted to ask the patients, how they felt. And some did say they felt a loss of childhood and a loss of their friendships because of their forced isolation. When they're in the hospital, they're not really able to interact with people their own age. They're mostly surrounded by their parents and other adults who work at the hospital, and they're away from what's normal. They're away from school and regular life, probably from siblings even. And so a lot of these patients did feel isolated, but there was some patients who actually felt that this forced isolation was a chance to reconnect with their parents. And despite the lack of peer relationships, a lot of them had positive bonding experiences with their parents and other family members. And this was really supported by any existing secure attachments that they had to their caregivers, which was a really cool thing to see, that secure attachment is so interconnected to child development. Lastly, the theme that I thought connected to this topic was research can promote children's well-being. Obviously, we know that research can be done and it can benefit people. And so some of the research done that was applied from the adult world was the idea that moving patients early on would help with their development and getting home and out of the hospital faster in recovery. And so a lot of children in the pediatric ICU do have to be restrained or sedated so they don't harm themselves. And this has been shown to have negative impacts on discharge. So many hospitals have adopted this initiative known as Pick You Up, which is a protocol requiring physical therapists and other therapists to start mobility early on with pediatric patients in an attempt to make their recovery better and quicker. And that was done by Rogers et al. In 2023. Another study that promotes the child's well-being is the idea that information and communication technologies such as Zoom were helpful to patients that were hospitalized to maintain connections and fight any negative isolation outcomes they may be feeling, such as anxiety or depression from being in a hospital. And this was studied by Sawyer et al. Researchers found a couple really interesting things. First, they found that early infections such as things like the flu or RSV that require hospitalizations are impacting childhood development. Regardless of how many hospitalizations, whether that be a single time or multiple, they are associated with an increased likelihood of vulnerability. And the more severe the hospitalization, meaning if they require a ICU stay versus just a regular stay, if it's an ICU stay being more severe, there is a higher risk. Additionally, the most at-risk children were actually found to be males that were scoring vulnerable on the Australian Early Development Census because the study was in Australia, and they had the following characteristics of being younger in age, of their primary language not being English, so English being a secondary language, and them living in a low socioeconomic status. Furthermore, the early mobility study that was done with the PICU Up program was actually found to not be making the patients heal any faster than patients that did not have a similar program. And lastly, the researchers found that there was an increased odds of being developmentally at risk for patients or children that are already having mental, behavioral, or developmental conditions, or things like cancer, musculoskeletal, neurological, or respiratory conditions. I did have my research hypothesis supported. Children that are hospitalized were experiencing child development delays, but I was shocked to learn that the mobility skill was not being affected. And in the Rogers et al. Study, they actually saw the early intervention mobility, that Pick You Up program, was actually virtually having the same outcome as patients who were not undergoing the same type of program. And so skill of mobility is not really affected in hospitalization outcomes. As I've said a couple times in conclusion, children are experiencing developmental delays when they are hospitalized, and there wasn't much evidence for the physical delays. So the question is kind of what can we do? And the answer is prevention. A lot of the illnesses were related to something like respiratory illnesses, which there are things like vaccines for RSV now, so vaccinations are a huge prevention tool. Other things like things that are going to be at-risk behaviors, like wearing a helmet to prevent accidents, or maybe not doing some high-risk incidents. Like in my case, we see a lot of ATV accidents, and I personally would not recommend children be using ATVs. I think it's really risky. So I think prevention in that way can go a long way of just being as safe as you can be, or preventing any illnesses that are preventable is going to help prevent this child's development delays. And research is also showing that the risk factor is focusing on mental and behavioral implications, but there was a strong support that as long as there is secure attachment between children and their parents, there is going to be a better outcome in those mental and behavioral implications, which I think is a great reminder that secure attachment is really a foundational tool of child development. And lastly, that the research of this topic is something that is really important and would benefit children the more research we have. One of the studies, specifically the one that was looking at early mobility, had been done during COVID-19, and they never mentioned it in their paper. They had researched in 2018. They took all the data of the children in the hospital before the Pick You Up program, and then in 2019 had initiated the program and were taking that research and then compared the two. And there was never any mention of a pandemic, which is kind of crazy because we do know that the pandemic severely impacted hospitals. It probably impacted hospitalizations. And so it's curious to see how much research could be done on any physical mobility delays if more research was done. Sources here. And once again, this is just kind of my overall topic that hospitalizations are impacting child development.